Hi, David.
Hi, Eric.
How are you doing?
Very well, thank you. Good to see you.
And good to see you as well. Hey, David, first of all, look, big thank you for taking the time out today. What I know is a busy schedule for you at Total Foot Health, seeing all the patients that you guys have to see there. So really appreciate you taking the time out. And today we're going to be speaking about plantar fasciitis, a common foot problem that people have. And certainly I know a number of my clients have struggled with this. But look, before we get into speaking about plantar fasciitis, for the people that don't know you or Total Foot Health, maybe just give us a bit of background, please, if you could, before we start.
Thanks, Eric. We are a podiatry clinic based in Salisbury. We've been here for over 10 years, and we have a large team. We have 4 podiatrists, 2 foot health practitioners, and a rehab therapist. And we have a range of technologies such as video gait analysis to look at how people walk, and diagnostic imaging with an ultrasound scanner that helps us look inside the foot.
Fantastic. So you truly are, as the name says, Total Foot Health, a very comprehensive treatment clinic for foot pain problems, which is fantastic. Now, before we get into speaking about plantar fasciitis, probably just worth saying now at the start of this conversation we're having that this is for information purposes only. This is not designed to be for people to listen to and treat as a diagnosis or to self-diagnose or to start treating themselves. They would need to contact you and come into Total Foot Health for a face-to-face assessment.
Yeah,
I just want to make that clear to people listening. So let's talk about plantar fasciitis then. And first of all, can you sort of share with us what are some of the common symptoms that somebody would be exhibiting or describing in relation to plantar fasciitis?
Thank you, Eric. It's by far one of the most common conditions, and people generally report an aching or maybe a sharp pain under the heel, and it's generally worse on initial steps in the morning or after a period of rest, but can also get progressively worse through the latter part of the day.
Sure, and I know that some of my clients have mentioned this when they step out of bed in the morning. Is that something that you're...
Yeah, that's really the classic. That you're aware something's wrong. The pain as you put your foot down, and then it'll typically ease off as people walk. After a few moments.
Yeah.
Then return the following morning.
So again,
but then we'll return the following morning.
Yeah. And what about if somebody was sort of office bound, sat for a number of hours at their PC? Would they potentially have the same sort of problem?
Absolutely. Yeah. If you're in a sitting position, people who do a lot of driving, yeah, these tend to be people quite commonly affected by plantar fasciitis.
Okay, so those are some of the symptoms that somebody would exhibit. And what would be some of the more sort of common causes, and maybe some of the less common causes, possibly, of plantar fasciitis?
There's a whole range of factors that may contribute, but sort of foot and leg related issues such as having tighter calf muscles, the muscles on the back of the leg being tight, can make the problem worse. And people with a flatter foot tends to put more strain into the plantar fascia. Body changes such as putting on a bit more weight, and as we get older, and ladies going through the menopause and certain conditions like diabetes, people have had balance issues, and the footwear we wear, so slip-on footwear, if you wear lots of flip-flops or Wellington boots. So if people have had a sudden change in activity, maybe a sudden increase in activity, perhaps they've taken up running or they've a new job. So there's various issues that all contribute to trigger this problem.
Yeah, I mean, one of the common ones I hear in my area of expertise is people want to become fitter, so they'll take up maybe walking, so going from a sedentary, having not walked at all, to suddenly trying to do 10,000 steps, or trying to run. Some of the classic ones that I have come across.
Yeah, I agree. Yeah, very, very common.
Yeah. So those are some of the symptoms, some of the causes. And again, after a face-to-face assessment, what have been some of the treatments that you've recommended? people to help with plantar fasciitis?
Yeah, so like you say, patients really should make an appointment with the podiatrist, and then after an assessment and we've diagnosed this is the problem, for most people, advice on footwear, wearing supportive cushioned footwear, and exercises such as stretches and strengthening exercises, and lifestyle changes is usually enough for most people to make a full recovery. But in some cases, when symptoms aren't getting better, then we may recommend more advanced therapies such as made-to-measure orthotics, so wearing their shoes, or if pain is an issue, perhaps course of shockwave therapy or injection with a corticosteroid. And very occasionally, we might recommend a period of rest in a rigid boot to protect the heel and allow it to recover.
Sure. And what I like about Total Foot Health's approach to this and other conditions is that it's not going from the diagnosis straight to the top end. It's a nice progressive way that you treat people, from non-invasive and then taking them through this patient journey of different treatment modalities where required.
Absolutely, yeah. We'll tailor it according to the individual and what really is going to help them the most.
Yeah, that's fantastic. Hey, look, David, thank you for discussing plantar fasciitis this morning, looking at the symptoms, causes, and some of the treatments on the back of a face-to-face assessment. So for anybody listening today that would like more information about this condition, or indeed any other foot problems they may have, how can they get more details about Total Foot Health? Where can they go for more details?
They can go to our website, totalfoothealth.co.uk. There's plenty of information on the range of services we provide, as well as contact details, our phone and email address.
Fantastic. Hey, David, look, again, thank you for taking the time out today, and I'm sure we'll be speaking again about more foot problems in the very near future.
Thank you for having me.
Thank you.